Good day everyone! Today's video is all about me, systemic antifungals. The following are the azole antifungals with their generic name, brand name, and chemical name. The following are the echinocandin antifungals with their generic name, brand name, and chemical name. While the following are the other antifungals with their generic name, brand name, and chemical name. Their therapeutic classification is antifungal. The pharmacologic classification of azole antifungals are the following. Fluconazole is bistriazole derivative, itraconazole is synthetic triazole, ketoconazole is imidazole derivative, posaconazole is synthetic triazole, terbinafine synthetic allylamine derivative, and voriconazole antimycotic or triazole derivatives. The pharmacologic classification of echinocandin antifungals is echinocandin or glucan synthesis inhibitor. While the pharmacologic classification of other antifungals are amphotericin B is polyene antibiotic, flucytosine is fluorinated pyrimidine, griseofulvin is penicillin antibiotic, and nystatin is polyene macrolide. The pregnancy category of azole antifungals are the following. The pregnancy category of echinocandin antifungals are the following. While the pregnancy category of other antifungals are the following. Most formulations of nystatin are classified as FDA pregnancy risk category C. Nystatin vaginal inserts are classified as FDA pregnancy risk category A. Azole antifungals binds to sterols and can cause cell death, which is fungicidal effect, or interfere with cell replication, which is fungistatic effect, depending on the type of fungus being affected and the concentration of the drug. Echinocandin antifungals work by inhibiting glucan synthesis. Glucan is an enzyme that is present in the fungal cell wall but not in human cell walls. If this enzyme is inhibited, the fungal cell wall cannot form, leading to cell death of the cell wall. Other antifungal agents work to cause fungal cell death or to prevent fungal cell production. The drugs binds to the sterols in the fungal cell wall, changing cell wall permeability. Azole antifungals are administered orally. Ketoconazole is also available as a shampoo and a cream, and terbinafine is also available in a sprinkle formulation for children. Fluconazole and voriconazole are available in oral and IV preparations. Ketoconazole is absorbed rapidly from the GI tract, with peak level occurring within 1 to 3 hours. It is extensively metabolized in the liver and excreted through feces. Fluconazole reaches peak levels within 1 to 2 hours after administration. Most of these drugs are excreted in the urine unchanged. Itraconazole is slowly absorbed from the GI tract and metabolized in the liver by CYP4-5 system. It is also excreted through feces and urine. Posaconazole is given orally and has a rapid onset of action and peaks within 3 to 5 hours. It is metabolized in the liver and excreted in the feces. Terbinafine is rapidly absorbed from GI tract, extensively metabolized in the liver and excreted in the urine with half-life of 36 hours. Voriconazole reaches peak levels in 1 to 2 hours if given orally, and onset of action if given IV. It is metabolized in the liver with a half-life of 24 hours and excreted in the urine. While in the echinocandin antifungals, anidulafungin is given as a daily IV infusion for at least 14 days. It has a rapid onset of action. It is metabolized by degradation and has a half-life of 40 to 50 hours and excreted in the feces. Caspofungin is available for IV use. It is slowly metabolized in the liver with half-lives of 9 to 11 hours, then 6 to 48 hours, and then 40 to 50 hours. It is bound to protein and widely distributed throughout the body. It is excreted through the urine. Micafungin is an IV drug. It has rapid onset and a half-life of 14 to 17 hours, and it is excreted in the urine. While other antifungals such as amphotericin B and flucytosine are available in IV form, they are excreted in the urine with an initial half-life of 24 hours and then 15-day half-life. Their metabolism is not fully understood. Flucytosine is well absorbed from GI tract, with peak levels occurring in 2 hours. Most of this drug is excreted and changed in the urine, and small amount in the feces, with a half-life of 2.4 to 4.8 hours. Griseofulvin is administered orally and reaches peak levels in around 4 hours. It is metabolized in the liver and excreted in the urine with a half-life of 24 hours. Nystatin is not absorbed from the GI tract and passes unchanged in the stool. Systemic antifungals are used to treat fungal infections of the body and skin, including athlete's foot, onychomycosis, ringworm, histoplasmosis, aspergillosis, tinea infections, vaginal candidiasis, prophylaxis, and treatment of invasive fungal infections. Contraindications of azole antifungals. Patient with hypersensitivity to azole antifungals. Patient with hepatic dysfunction should not use itraconazole and ketoconazole to prevent serious hepatic toxicity. Patient with endocrine or fertility problem. Patient with liver impairment or toxicity should not use posaconazole and terbinafine. Carefully monitor patients for bone marrow suppression and GI and liver toxicity if using these drugs. Pregnancy and lactation. Voriconazole should not be used with patients taking any other drug that prolong QTc interval because that could be worsened and can cause ergotism if taken with ergot alkaloid. While the contraindications of echinocandin antifungals are patient with hypersensitivity to echinocandin and andinofulgin and micafungin should not be used during pregnancy and lactation. Caspofungin can be toxic to the liver, therefore reduced doses must be used if a patient has known hepatic impairment. This drug is also known to enter breast milk and should be used with great caution during pregnancy and lactation. While the contraindications of other antifungal agents are the following: patient with hypersensitivity to these agents, amphotericin B is contraindicated during lactation because it can potentially risk to the neonate. Also, this drug is available in several brand names. Caution must be used to differentiate the brand used as the dosages vary. Flucytosine is contraindicated to patients with renal impairment since it is excreted primarily in the urine and should be used during lactation and pregnancy only if the benefits clearly outweigh the risks. Nystatin is not known whether it crosses the placenta or breast milk, so it should not be used during pregnancy or lactation unless the benefits clearly outweigh the potential risks. In CNS, the adverse effects are headache and mild CNS changes for griseofulvin, serious hypersensitivity reactions particularly with micafungin. In GIT, hepatic failure, nausea, vomiting, potential severe diarrhea, anorexia, weight loss, and GI irritation. In immunological, bone marrow suppression, rash, and dermatological changes. In renal system is renal failure. And local is pain at injection site with phlebitis or thrombophlebitis. Before, assess for the mentioned cautions and contraindications to prevent untoward complications. Perform a thorough physical assessment to establish baseline data and to determine effectiveness of therapy to evaluate for occurrence of any adverse effects associated with drug therapy. Obtain a culture of the infected area to make an accurate determination of the type and responsiveness of the fungus. Evaluate renal and hepatic function tests and complete blood count to determine baseline function of these organs and to assess possible toxicity during drug therapy. During, check culture and sensitivity reports to ensure that this is the drug of choice for this patient. Ensure that the patient receives full course of antifungals as prescribed to get the full beneficial effects. Monitor IV site to ensure that the phlebitis or infiltration does not occur. Provide safety measures to protect the patient if CNS effects occurs. Provide small, frequent, nutritious meals if GI upset is severe. Monitor nutritional status and arrange a dietary consultation as needed to ensure nutritional status. Advise patient to report sore throat, unusual bruising or bleeding, or yellowing of eyes and skin, all of which could indicate hepatic toxicity or severe nausea and vomiting, which could interfere with nutritional state and slow recovery. Educate client on drug therapy to promote understanding and compliance. After, monitor patient response to therapy. Monitor for adverse effects mentioned earlier. Evaluate patient understanding of drug therapy by asking the patient to name the drug, its indication, and adverse effects to watch for. And monitor patient compliance to drug therapy. That's all. Thank you for watching.